Well, hello, everybody. Hello, Heal Circle. Yes, indeed. This is Joel Kahn. And if you're wondering where in the world is he, I'd like to tell you I'm in Bali, I'm in Fiji, I'm in St. John in the U.S. Virgin Islands or some other beautiful situation. But I'm actually with Rena on Zoom, and you can set up a virtual background. So we're having a little fun since you've either celebrated Hanukkah or tonight you're celebrating Christmas Eve and Christmas, or soon you're celebrating Kwanzaa, or maybe you don't celebrate any of those, you're just celebrating because 2020 is drawing to an end. But I'm celebrating with a virtual beach scene and a palm tree, although here in Michigan, we are far, far from the scene you're seeing behind me. But it's fun. We can use technology to raise our spirits, raise our health. Sometimes technology gets in the way of our health, but we're using it here to raise our spirits. So wishing everybody good health, everybody a good, safe, healthy 2021. Maybe I'll share for a minute a quick little personal note. About 4 weeks ago, I just felt a little off for one day. Didn't even mention it to anybody. Felt just fine and worked all day long like I do most days about 4 weeks ago, 5 weeks ago. And then on a Sunday morning, my wife was making a saute of vegetables, and I realized I couldn't smell anything. I could not smell the garlic I saw her chopping and some of the other fresh vegetables. And I went over and took the biggest inhale I could. I could not smell a thing. So you probably figured it out by now. I went and got my first and only nasal swab, and I was positive by the quick test and positive by the PCR. So I stayed home for over 10 days and did a Zoom clinic and isolated. Fortunately, excuse me, I don't know why, but our cold weather in Michigan's got my nose itching. I apologize. But fortunately, my mother, who had dinner over the night before, my wife, who obviously lives in the house, and others, nobody got sick. There was a little concern, and I had COVID. But that was it. That's the whole story. My smell came back
Wow.
in a couple days. I have been since March following a protocol by a professor at East Virginia Medical School named Dr. Paul Marik, M-A-R-E-K, M-D. Very, very well-known professor of pulmonary and critical care medicine, probably the world's expert on using IV vitamin C in the ICU for sepsis and serious infection. But he had a suggested, he's an academic doctor. He clearly said back in March, I can't prove this is going to work, but it's inexpensive, safe, and reasonable. I've been taking vitamin C, vitamin D, melatonin before bed, an unusual antioxidant called quercetin, but it's a capsule, Quercetin, and our good friend zinc. And I've been taking that combo every day, and I think it helped. Plus, what I hope is good sleep, a extremely good diet, and regular exercise. You know, if everybody had COVID the way I had COVID, we wouldn't be worried about disrupting lives and families and the economy. I'm just very grateful for that. So I wanted to share that. You've had other issues. So many people haven't been able to go to family funerals, family weddings, celebrations. We're lonely, we're isolated, we're depressed. Some of us, our finances have suffered, significantly in 2020 because we're in real estate or we're in restaurants or we're in other industries that have been slaughtered by what we've had to do in California for sure, in Michigan for sure, and many other states. Anyways, let's look up positively with the beach behind me to a happier, healthier, mental health, physical health, financial health, spiritual health 2021. And I think Heal Circle and Rena's hard work and your enduring support and interest will make all that happen. So that on a personal note from the Kahn family, from my clinic, the Kahn Center for Cardiac Longevity. Fortunately, my staff stayed healthy. They did not get what I had, and I'm grateful for that. Now, interestingly, and last little piece, I just had my blood drawn 2 days ago, and I have very strongly positive COVID antibodies. My hospital has the vaccine, and physicians are being vaccinated, but I have been demoted way down the list because I have a high antibody level, and they want to save the vaccines for people who don't have a recent COVID infection and have fully recovered. It's unclear. We've been saying 3-4 months that a exposure to COVID may give you some protection. We're not sure how much. The latest data is it may be 6 to 8 months of protection. The antibodies may stay positive for that amount of time. In fact, in a very prominent journal called the New England Journal of Medicine, there's a study yesterday that if you have antibodies, your rate of infection when you're around people that have COVID is very low compared to the general public, confirming again. But for most people, we're very eager to see the vaccination. We got to get the healthcare workers, we got to get the front line, we got to get the elderly, we got to get those at extreme risk. And then the general public will be somewhere further down the line. And fortunately, we'll have more data by then. This first wave in the last 10 days of many of my colleagues, nobody's been terribly ill. There's a little bit of achiness or arm. Interestingly, a cardiologist I know in New York wears what I talk about a lot, an Oura ring, and she's been tracking her Oura ring measurements for deep sleep, REM sleep, heart rate variability, and they've changed a little bit since she got the vaccination. It's probably her immune system, fired up. They've actually changed a little bit for the worse. They'll come back. It's an interesting observation. But let's end this beach scene with happiness, with joy, with 2021, hope and energy and health and Heal Circle and Rena's input. And Rena, anything you want to share?
Well, first of all, Dr. Joel, I want to congratulate you for thriving through a COVID attack. It sounds like you beat the virus. So,
right, I did. It beat me a little bit, but as I say, I'm very well aware that there, maybe even somebody in our circle has either had somebody with a serious COVID illness or a death. This is, clearly something that isn't just a touch of an illness. I'm very fortunate. Maybe I prepared for that very mild COVID, or maybe I'm just lucky. I'm certainly not, pompous about it. I really wish in 2020 more people shared the message. Medical people, health people. This is an opportunity to get your weight under control, your nutrition enhanced, your sleep better, your alcohol down, your stress down. We heard that, but we didn't hear it consistently. We almost never heard it from governmental officials. With all respect, even to Dr. Fauci, he mentioned late in the year that he takes vitamin C and vitamin D and zinc, but the rest of the package, the lifestyle package, which has to help your immune system. If we could have had a lot of America lose 10, 15, 20 pounds in 2020 as a national effort, maybe I should become the Surgeon General of
there you go.
Better health. You go. I wish we would have heard this more consistently, but
Biden's more.
We have Heal Circle. That's right. That's why we're here. We're doing something beyond the average. But
and maybe 2021, that's what will kick off. But I'm a numbers person. So how many days were you down in total?
Well, I stayed out of the office about 12 days. The recommendation from the CDC is 10 days once you're well. And I never had a fever. I never had a cough.
Well, that was my question. So how many days were you actually sick, other than the lack of smell?
Lack of smell, 6 days. And I wouldn't call that sick. I just call it, it's odd not to be able, I would take, essential oils and just every day test really potent ones. But then it came right back. I think a lot of zinc gets credit for that.
That's right. But that was it. You didn't have fever. You didn't have shortness of breath.
Never had shaking. I had a night where I didn't sleep well. Who hasn't had a night where they didn't sleep well? But in retrospect, I think that's 5 days later is when I lost my smell.
Okay. So then the other question I have is, do you know who you got it from?
Now, we have Zoom patients and live patients in my con center. And about 3 weeks before I think I got it, we did have a patient who emailed later, I apologize. When I saw you, I was fine, but I now, the next day, have had a swab that's positive. But 3 weeks is too long. I don't think it was that elderly individual. Unfortunately, he did fine too.
And then no one in your household got it. So why do they say it's the most?
In the household. I've been pretty isolated. This is a side story, personal note. I confirmed that I had COVID 5 days before my 27-year-old daughter was supposed to be married. And that wedding had gone from 200 people to 40 people to only 7 people.
Oh, wow.
And she made a decision, I don't want my mom and dad at my wedding by Zoom, so we canceled the wedding. but I say that not so much that I want a tear out of your eye. She's an amazing kid. He's an amazing future son-in-law, and they'll clearly get married in 2021. But I had been very cautious. I wasn't at restaurants. I wasn't at bars. I wasn't out at big stores because I knew that there was this wedding coming up, and I really wanted to limit, my general contact with the public. So it was just my office and a gas station and, a few essential visits like that. But so not sure. That's a lot of asymptomatic people, we believe, have it. And
But also
I'm
the fact
wear a
that
mask in public. I mean, I do have masks.
and the fact that no one in your household got it, if it was the most infectious thing we've ever seen,
Right.
wouldn't your wife have got it?
You would, because there were those 5-6 days before I lost my smell. And I mean, we live in the same house. We
Of
sleep in the
course.
same bedroom. We're not one of the married couples that are, different bedrooms. So, yes, it's pretty remarkable. She's got
So,
excellent nutrition, excellent fitness, excellent sleep. She takes her supplements. I'm curious to have her tested for the antibody. I mean, she could have had an asymptomatic case, and I'll report back should we confirm that she probably did get it from me. There is a little tiny joy to having the antibody, and
sure.
we thought for a couple months, and as I just mentioned, and maybe more, this week there were 2 reports, 6 to 8 months. There still is a recommendation to get the vaccine, but that's really an emotional statement. It is more scientific to say, let the next person have the vaccine.
Exactly.
You have recent high antibody levels like it.
Exactly. I will just plant this thought for anyone listening and for you, not looking for a definitive answer, but my common sense thinking says, how incredibly contagious could it be? Because yours is not the only story. I just have another friend. He's a orthodontist who's out and about, 5 hospitals. She's a dentist. They have a practice. He was diagnosed. They have 7 people living in the house, including a very elderly set of parents and another older parent. Only he got it, very mild. My friend got it, extremely mild. None of the elderly got it. They all live in the same house. They all eat together. None of the children got it.
Yeah.
And they could not identify the source
Yeah.
for my friend catching it the first time around. And by the way, they reached out to all the patients because it's 5 hospitals. No one in contact with him prior got it, meaning no employee, no patient. So I'm going to just plant this. Have we really figured out what it is?
Yeah. Yes, and I agree with you. We've got a lot to learn. There's a variant now in England that's
Yes.
unclear if it's milder or stronger, whether the vaccine covers it or not. This is a moving target. We can only pray that there is clearly much more therapeutically to do for it.
Yes.
Maybe we'll figure out how to share this. It's really too much. But this professor in Virginia, Dr. Merrick, updated the March recommendations that I've been following in November, and now it's a 39-page PDF. And I don't know that I can link that on Heal Circle, but if somebody is in the medical world and wanted to read, a proposal, the preventive and outpatient treatment of COVID is still, not been really figured out what's optimal, but I do really respect this guy. And so I've been following his recommendations. I'll send it to you when we're done here, Rena.
Okay, that sounds fantastic. Wonderful. That's it on my end. I want to again take just a quick moment to wish everyone an incredible rest of the year. May next year bring so much joy, peace, and love into your life. Yeah. Stay healthy, stay smiling, stay masked. Dr. Joel, sending you big hugs.
Absolutely. And I'll say what we did in 2020, consistently once a month, calls and questions. And then I've tried to have daily posts. I missed a few, but pretty close. And I just posted one about 40 minutes ago. Please look at it. The highest heart attack rate of the year is Christmas Eve for the entire year. So be careful. Eat well, drink limited or not at all, get your sleep, and be careful in terms of COVID precautions. But we saw so much lifestyle data in 2020 about plant diets, fitness, sleep, stress management, breath work, weight control. supplementation, new toys. Maybe we'll do our next one about, I've got both wrists, and maybe we'll talk about the two toys I'm wearing on my wrists that are advanced monitoring and advanced lifestyle upgrade, health upgrade, wearables, all kinds of fun stuff. But happy 2021 to you, Rena, and your family, and to the Heal Circle family from the Kahn family.